We will now call this meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Joanna, please take roll call.
I'd like to announce that Director Sargent has informed us that she will not be able to participate this evening. She has a conflict. President Carmela Garnica.
Here.
Vice President Rosie Rowell.
Here.
Director Dr. David Brooks.
Here.
Director Sandra Hudson. Thank you.
Okay, public comment. This is an opportunity for the citizens to speak on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. For the record, please state your name. The board has a policy of limiting any speaker to not more than 3 minutes. The board cannot take action on items not listed on the agenda, and board members will not enter into discussion with speakers, but may instead refer the matter to staff for report and recommendation at a future board of directors meeting. Public input may be offered on the agenda items when they come up for discussion and or action. Is there any public comment?
Who's that? Real quick, Elizabeth. What is that?
Good evening, Elizabeth Bailey. Good evening, members of the board. Rosie, at the last meeting, you stated that you don't believe you've done anything wrong as a board member that would warrant your recall. Let's be clear about how recall works in California. Under the California Elections Code 11,386, a recall does not require negligence or misconduct. You serve at the will of the voters. If the people lose confidence in your representation, they have the absolute right to recall you. Even if you have done nothing wrong, the voters can still decide you no longer represent their values. But here the situation is worse than that. The hospital is teetering on the edge of bankruptcy. The public has repeatedly raised concerns about meetings that we believe are not being conducted properly. Time and again, the public has asked this board not to move forward with certain decisions, and yet you have gone ahead and done exactly that, disregarding the will of the community you are sworn to serve. According to the official minutes of the June 25th, 2025 board meeting, pages 16, during closed session, item 9B, number 2, this board voted unanimously to appoint an infection control practitioner. The vote was taken by Directors Hudson, Brooks, Brown, and Garnica, with Director Sargent absent. The appointment was awarded to Melody Bowen, who is the daughter of Director Rosie Rowell. Rosie failed to abstain from this vote, and her daughter received the contract. This is a direct conflict of interest under California Government Code 1090, which prohibits public officials from being financially interested in contracts they approve. In addition, Government Code 87100 under the Political Reform Act prohibits any public official from making, participating in, or attempting to influence a governmental decision in which they know they have a financial interest. The fact is, this hospital laid off 16 employees as a cost savings measure. At the same time, the clinic continues to operate without the public knowing basic facts, such as what is the average daily patient count at the clinic? How much has the clinic billed to date? What is the average bill per patient encounter? What is the average daily cost to operate the clinic? Until these questions are answered, the community cannot know if the clinic is serving its purpose or draining resources that the hospital cannot afford to lose. This hospital, in closing, this hospital belongs to the people of this district. The voters have every right to demand accountability, transparency, and to recall board members when trust has been broken. And Joanna, I'm going to give you this. It's an official public records request for said items.
Any more public comment?
I would like. Sorry, that's okay. Good evening, everyone. I would like to publicly respond to an ADA accommodation request that we received. I'm sorry. I think I don't need the mic. I'm pretty loud. Thank you. The district is currently seeking proposal from various IT vendors that provide several of the services referenced in the correspondence that we've received. These proposals will be presented to the board at a future meeting. Pursuant to the ADA, the board will review the proposals to determine their financial feasibility before making any determinations regarding their implementation. In efforts to promote transparency, a YouTube channel has been created and will be used to upload videos, recordings of board meetings. This initiative is also intended to accommodate individuals requiring accessibility and other accommodations, ensuring convenience accessible to the meetings. I would also like to let everybody know, I had provided the flyers in the back of the room. I'm not sure if there's a copy back there, but if not, I will also upload this to the website tomorrow. It gives you on the website of the PVH YouTube page where the recordings will be uploaded. Thank you.
Public comment?
Mine starts with Ms. Anaya. I looked up the definition of chief executive officer. The CEO, you are to maintain executive accountability for the hospital's overall operations, strategic direction, and financial stability. But what stood out to me was the financial stability. Have you taken steps to ensure this hospital's well-being? Have you made any effort to protect it based on your own comments? This issue started in 2020 during the COVID. Yet during these difficult years, you constructed a clinic and exceeded its budget by $1.5 million. Is that how you manage the financial well-being of this hospital? In 2023, you guys borrowed $8.5 million without making any repayments, expecting that it would be forgiven. When you awarded a $30,000 bonus to your chief nursing officer, that's not putting the financial health of the hospital at first. You depended on your line of credit from Provident Bank each month to meet financial obligations. Is that a responsible financial management? We've requested financial statements and reports for months, but our requests have been repeatedly ignored and delayed. Various organizations have offered to help you, but you've turned them away. This is not caring for the hospital's financial health. The final straw for me was during the last meeting when it wasn't even deemed important enough for you personally to show up, nor your CNO/coup to attend while a vote regarding potential filing for the Chapter 9 occurred. Is this your approach to managing the hospital and maintaining its financial health? Absolutely not. Yet you still have the nerve to draw a salary for a position you have not fulfilled. If I understand your salary correctly, it's for a facility for 25 beds. The ER certainly does not accommodate 25 beds. Perhaps you should refund the hospital some funds, if only for the sake of its financial health. Blame anyone you want, the CFO, the coup, the Provident Bank, the ultimate responsibility lies on you. I believe the COVID crisis netted the hospital some $6 million, and you stated it had to be paid back. So where's it gone? It was a grant and did not have to be paid back. Add the money up since 2020, $6 million for that, 8.5 plus, and all the money coming in, and you're still $12 million in the hole. And you're begging for financial help. You've not upheld the financial health of this hospital. You are the one deserving of criticism and contempt, while those shortcomings are yours. It certainly does not relieve the board of directors, Carmela, Rosie, or Trina, of their responsibilities. All of you have taken in everything this attorney has told you without question, and this board does need to be recalled.
Any more public comment?
Hi there, my name is Joshua Cohen. So I've got a couple questions and I don't really need you to answer them, but they will be important in the context of this text, for this speech. Who is a board formally authorized to prepare agendas for meetings? And I asked for a full list of names at some point in time, because according to your bylaws, it's supposed to be just a secretary. Are any of you familiar with what metadata is? It's okay if you don't, but you're gonna find out. So background and violations. Under the Brown Act, authority to prepare agendas can only come from the legislative body itself, being you, not from individual members, staff, or consultants. The authority cannot be delegated informally. Yet, metadata analysis of your agendas has shown repeated violations. Some agendas were created or modified after legal posting deadlines, sometimes even the same day of the meeting, or even months after the fact. Most concerning, metadata shows that agendas were prepared or altered not by district staff, but by outside parties, including Attorney Lena Wade, Attorney Kevin Crowther, Consultants Vivian Beek, Bob Mara, and even the state DHCS employee Vanessa Burke. Despite this, every agenda still carries an official signature of the district's board clerk, Joanna Gonzalez. This raises an obvious question. How does a signature of someone appear on a document created or altered by someone else? Sometimes even after the meeting already took place, because that's definitely the metadata. When her signature remains and alterations are made, it implies that she has vouched for the authenticity of the document that was no longer hers to certify. This has serious implications for record integrity and public trust. So now we get to what metadata is. Metadata is data about data. In a PDF, it records when the document was created, when it was last modified, by whom, and by whom, I'm sorry. The information cannot be erased by simply copying or downloading the file. In these agendas, metadata shows the actual timeline and preparation and alteration. The timeline does not match the statutory requirements. The Premier Healthcare Contract. The board's handling of the Premier Healthcare Contract shows another violation. The item was placed in closed session under the claim of confidentiality. The Brown Act allows closed sessions for only narrow purposes such as litigation, real estate negotiations, or certain personnel issues. A contract renewal with a vendor does not qualify. Withholding the item from the public discussion unlawfully deprived the community of its right to transparency. This was an illegal closed session and an improper withholding of information. When he fought the issue in the July 30th meeting, Dr. Salobi was right. This is not a discussion that needs to be behind closed doors. Legal significance. The Brown Act requires agendas for regular meetings to be posted 72 hours in advance, like 24 hours for special meetings. When agendas are created late, changed after posting, or altered by people not authorized by the board, the meetings run off. The Brown Act also makes it a crime for members to knowingly participate in a meeting or take action when they understand the agenda is defective or illegal. If board members proceed with business on an agenda that they knew was questionable, that constitutes not only a violation, but a right. Really?
Is there any more public comment?
Anybody want to take the rest of my signature sound like this?
Here's the last word.
Yeah, right there, underneath.
Implications? Yep. Great.
Hi, my name's Tara Fain. I live at 850 Oasis Village Court, Blythe, California. I'm going to go ahead and finish off where he left off. Impacts. Board members are left unprepared if agendas they reviewed are later altered. The public is misled into thinking that an agenda is final when it is not. Trust is governance erodes because officials records appear compromised. The misuse of closed sessions for the Premier contract deprive the community of oversight. Actions taken under knowingly defective agendas risk criminal liability for participating board members. The Brown Act exists to guarantee openness and fairness. Metadata and board actions show the district has not met that standard. These concerns demand accountability both to protect the board members themselves and to protect the public's right to lawful, transparent governance. Because the legal, financial, and political skills stem in large part from the advice and involvement of Attorney Lena Wade, I urge the board to terminate her contract, continued and reliance on counsel whose actions and guidance expose the district to violations of law only compounds the damage. Want me to read background?
Well, and also mentioned that this meeting, the metadata shows that this meeting is a violation as well.
Okay, he stated that this meeting also shows that in the metadata it's also a violation as well.
Any more public comment?
Hi, I'm Joanne Sabara, and I just wanted to address the first person's speech to let them know that Rosie did not attend the meeting to vote on her daughter's position being changed to infectious disease. She actually recused herself. So I just wanted that on record. Thank you.
Any more public comment?
My name is Mark Verona, and I'm just here to support Rosie because I've known her for 30 plus years. And she's always been a good person, and she doesn't need to help her daughter out or herself. I just want to make sure that everybody can see her in the light that I see, because I've known her for that long. I don't have too much to add other than that, but I do want to keep the clinic open because I think it serves the community in the best way possible. I don't know the inside, what goes on the inside, but I know when you go there, you feel like you can trust the staff, and the staff is very supportive. So, that's all I got.
Amen.
Any more public comment?
Now, when it comes to a recall, who pays for that? I think we do. And we've already blown enough money that our hospital is broke. So I don't see the point in recalling the board. There's a member that wasn't elected. Was everybody elected on this board? Who wasn't elected?
No.
None of you? So how do you recall somebody that wasn't elected? I don't know how anything happens in this community.
Any more public comments?
Ma'am, can I get your full name?
Kathy Linares.
Thank you.
Hello, my name is Samantha Joe, and I just want to say, I don't know all the ins and outs when it comes to exactly how the hospital operates, but I will say that the people here standing in front of me have been tremendous help in the community. Each one of you guys have put yourself out there for the city of Blythe, and I know that having a hospital and having a clinic has been a big help to us. My major fear is knowing that what will happen if the hospital and the clinic falls apart. Where would the Blythe community go? I will say that Palo Verde Hospital, when I first came here, because I'm not originally from here, I'm from Virginia. I've been in Blythe for 5 years. When I say I first got here, I was like, I don't know. Hospital was like, maybe not. But then I tell you what, that hospital saved my mother's life. And it really changed the view of everything, how I felt towards the hospital. And if I didn't have the hospital, I probably wouldn't be here still to this day to continue to help out with the community because I'm a clinical therapist. So I help with mental health. Every day I get up, I come out here to see what can we do to better this community. And all this pointing of the fingers and who did what and what's right and what's wrong, at the end of the day, what can we do moving forward? From this, I understand we had a lot of mistakes, we had a lot of mess ups, but right here today, what can we do moving forward? How can we keep this open? Because if this shuts down, where are we going to go? There are people out there that cannot make it 45 minutes. There are people out there that don't have the family support or friend support. They're by themselves. So I want to look at the bigger picture. When we leave this space today, what steps can we make to move together? Instead of fighting one another, instead of creating these bridges, these gaps, how can we come together and make that change for the Blythe community? Because we need everybody. This is a teamwork here. It's not something that you can do alone. And we all have to come together for that to happen. So that's all I want to say. Yeah, have a good one. Any more public comments?
Hello, I don't know
that I'm gonna need the microphone, and I wasn't prepared for anything tonight, but my grandmother invited me to come here, and I just wanted to say, my name's Melissa Woodruff. I'm a special education teacher. I'm going on my 4th year. I just started my master's degree to be the school psychologist here in our district. And my whole driving factor for that was to better our community. I moved my fiance here from Southern California on the hope that Blythe, California was gonna be where we spent our whole lives to be closer to family. I have a sister in Phoenix who's pregnant right now, who's waiting to have her baby to return to Blythe because she doesn't feel safe having it in the hospital. And the fact that we come here to better our community and to be with our families, but we don't have the faith or trust in our healthcare is really scary. And when it comes to grandparents and wanting to be here for them, I have grandparents that can't make it to a hospital if something happens and it scares them. And like the previous speaker said, I don't think that we need to be fighting with one another, but I think that you have concerned community members and we need to have a concerned staff and we need to have a concerned board. And we need to put the financial matters aside and think smart and not selfish and come together to be better so you have people that want to stay here, because if we don't have a healthcare system, we're not gonna have anybody here that's going to want to build the community and we're gonna fall apart as a whole. And that is all.
Any more public comment? So if there's no more public comment, oh. Yes.
Well, I've been trying, well, since all day, I've been trying to find the minutes of August, also July 30th, even though on the agenda it says it's item number 11, on action item 7A11, it says minutes from 7/30/2025. It's not in the agenda package that was provided to me, so I don't know if it was provided to everybody else or not. And that should help to see whether or not Rosie voted or didn't vote. I'll start by saying that I echo the last speaker. I think this hospital is essential to this community. I've been a physician, a surgeon at this hospital for the last 27 years. And I've always had friends and foes on me that told them all the time one thing: the job of this board is not to practice medicine, is not to be forensic accountant, but the job of this board to make sure that the financial stats of this hospital is solid. They make sure that you have the money. And if things go south, as Sandy had said, it's going south since COVID. Well, what was your plan since COVID? That's 5 years ago. It's not whether or not you point finger at. I know Carmela and almost all of her family. I can't say they're a friend. I know Rosie and her daughters. I know Dr. Brooks. I know Andy Hudson, and I know Trina. We worked together for years. But it's not a matter of whether or not it's a job that you feel somebody pat you in the back and you feel like I have a power to be on the board. You know, if you guys can't handle it and the hospital is going down, going to bankruptcy, why not resign? Randomly pick somebody else, pick somebody randomly, put them on, but maybe they have a better idea. It's not whether or not you put my friends or foe, but if somebody can't do it, you know, we used to have Peter Bloom here, I know most of you knew that. When things went down and the hospital was losing money, quickly, multiple meetings, he brought his friend, and they all said, oh, he is doing a great job. Well, as that lady said, the hospital finances is very complex, not everybody knows that. But you guys need to listen to the community, needs to do things right. You know, I have to make a correction last meeting. I said I haven't been paid by the hospital for 3, 4, 5 months, but they issued me two $10,000 check. So they still owe me over $100,000. They haven't paid me for a few months, but they do that. And, you know, we ask simple question. The community deserves to have an answer, okay? Dr. Brooks, did you donate $20,000 to the hospital foundation a few years back?
At one time,
Good, okay. Why is that Dr. Bush can answer that question, but if I ask Rosie something, she won't answer?
Okay, 3 minutes up. Any more public comment?
Rocha. I don't know you two, Dr. Brooks has been a pillar in the community for as long as I can remember. I love you. Trina I have a son here that was sick, he had cancer, he passed away, she was there every second. Sandy Hudson, like a second mother to me. I haven't lived here in a long time, I recently moved back, so I'm not really sure what happened here, but the healthcare system is not just a normal job. You have people's lives in your hands. And this community, my family has lived here for years and it's dying. And if we lose our hospital, the town's gonna die. I have kids that go to school here. I mean, we all have kids here, whether we have kids or not, because in this community, all of your kids are my kids. You know, what happens to the next Riley that's sick and can't go to the hospital? What happens to the next grandma that's having a stroke and can't go there? And if you don't care about anybody else, the river. We can't have recreational things here without a hospital. They're trying to bring the rodeo here, the car races, all the stuff they're trying to do to build our community. We literally cannot have it without a hospital. So even though Rosie and Carmela, I don't know you two, you don't come into a job like this without a good heart of wanting to do something good for your community. Being in the healthcare industry is not easy. It's hard, it's sad, it takes a toll on you. So I'm just, from looking from the outside in, I'm not really sure why we have a clinic. Don't know how that happened. I don't know why we have a lawyer here. I can't even afford to have a lawyer fill out paperwork for me. God knows how much we're paying for that. You have a policeman here. I've been to so many meetings in other towns, that a policeman has to be here is just sad, because this community loves each other. And I come to these meetings trying to figure out what's going on, and people stand here and they ask you questions. But the main one is, how can I help? And nobody answers any questions. So I don't know how these meetings work. Maybe you're not allowed to, maybe you just don't answer questions, but you have a whole community that wants to help. Maybe they'll volunteer. This has been going on for so long, but people are asking. So I don't know what else to say, just whatever you can do or can't do or have somebody else do, you know, we're losing our community.
Any more public comment?
Hello, my name is Adriana Figueroa, and I was born and raised in Blythe, but I've lived in a city for most of my adult life. I feel like it is basic knowledge that things need to change. So what my question is what are the things that you guys are going to implement? Dr. Brooks, you're an amazing person. Carmela Garnica has been running a successful business for decades, preschool teacher. I don't know you, Rosie, but I am confident that with the right staff and determination, hard work, and support, that if you are given enough time, you can succeed with Carmela being lead. She hasn't failed yet. So what are the positive things that you guys have planned? We know all the bad stuff. What's the good stuff coming?
Any more public comment?
Good evening, everybody. My name is Elizabeth Rojas. I just want to come up here. I was not planning to, but I want to thank Dr. Brooks for all of your hard work. I was one of your patients, for many years before you stepped down. Carmela, I want to thank you from the bottom of my heart for everything that you do for the community. Keep going strong. I know there's a lot going on right now, but hopefully things get better, and because we need our hospital. I'm health-wise, I'm, always sick, I visit the hospital a lot. I wanna thank, Trina, she's not here, but I had a very bad experience one day at the hospital. She stepped in and basically they were, anyway, she took care of me. We need the clinic. I see specialists out of town, but my go-to is with Dr. Sylvia. She's amazing and we need it for our kids. I have a granddaughter that, gets sick a lot, needs breathing treatment, things that, so I just hope that we all come together as a community and, find a solution, instead of, pickering at each other, and I think it's just time that we act like adults and, move forward with, everybody, coming as one, because that's what we need for our community to keep our hospital here. Thank you.
Any more public comment? Since there is no more public comment is now closed. Now we have board comment. Dr. Brooks, is there anything you'd like to say?
No.
Ms. Hudson, is there anything you'd like to say? Yes. Yes.
Yes.
No, we can't hear her.
Okay, next, Ms. Raul?
I have a comment, yeah. The last time we were together, Dr. Salobi made comments about my daughter. I want you all to know, I have a daughter, she's an RN. She has worked at this hospital for 25 years or more. She has been an RN on the med-surg floor. When the hospital got to the point where we needed to reduce costs, the med-surg floor was closed. Okay, all of the nurses on med-surg were either, two of them I think were resigned and went on to greener pastures. The others were given other departments to work in. One of the departments that was open, because the person who was in that department resigned and moved out of state, was the infection control nurse. Management, without my encouragement, my even knowledge,
went to my daughter and said, would you like to take over that department? She said, yes. It came to the board because, I don't know why, but it came to the board for approval. During that vote, I recused myself. All right? I did not vote. Okay. While all of this commotion was going on last time, somebody made a mention that she was getting $140,000 a year. Wrong. That position doesn't even pay $140,000 a year. That position pays the same rate that any nurse in the hospital gets. My daughter is making the same amount of money in this position that she was making for 25 years in the med-surg department. I think we have to be really careful what we say. People get hurt. My daughter was hurt when she heard what Dr. Salopi said, and they have known each other for 20 years and have worked hard together. He used to respect her, and she used to respect him. I would appreciate people understanding that before they say something, they need to verify it and make sure that they're telling the truth. That's all I have to say.
I do have a board comment. First, I'd like to say that I was publicly appointed as a board member for the Palo Verde Healthcare District for the last 10 years because no concerned citizen applied. My term will be over in approximately 12 months. In February 2023, the organization, a 501c3 since 1972, and where I am employed, was granted $67,500 for COVID-19 work. The Palo Verde Hospital District submitted a grant application to the California Department of Public Health. 10% of that grant was for the Palo Verde Hospital District Administration, and the 90% was for the chosen nonprofit. The California Department of Public Health chose the nonprofit organization I work for. Other applicants, such as the Blythe Rotary and the Chamber of Commerce, among others, did not qualify from Blythe. The project period was short-lived and closed within weeks by the California Department of Public Health. In October of 2023, a co-board member, Sandra Hudson, filed a conflict of interest complaint against me, and therefore I was investigated and all the paper trail was submitted, including my Form 700. Mrs. Hudson's complaint was rejected by the Fair Political Practices Commission in November of 2023, which she had knowledge of. I have personally handed out the rejection notices to the public twice at different board meetings. In November of 2024, I was elected board president when Ms. Hudson resigned for the second time. In January 2025, the Palo Verde Hospital District was cyber attacked. Palo Verde Hospital District operations suffered. Cash flow slowed. Instead of walking away like others who resign, then resign, and then again return, I have committed my time and resources to strengthening both the nonprofit I work for, the Palo Verde Hospital, along with Palo Verde Hospital Clinic, which serves so many in our community. Being an advocate for our community during times of crisis, like during COVID-19 pandemic, I spearheaded a campaign to ensure our community people had the resources and the support they needed through the grant from HRSA, Health Resources and Service Administration, and through a grant from the Office of Community Partnership and Strategic Communication of the state, to a total tune of $500,000. Through these efforts, youth were employed to secure opportunities, through summer work experience programs, and to low-income families through food drives and other family childcare that provided relief when it was needed most. The final grant approved most recently was a $2.5 million from First Fire in order to provide subsidized childcare for the community parents while they work and hire people to work. In the past, during the hot summer temperatures, through a grant, we had food centers for 15 years, supported by the Southern California Edison to protect vulnerable residents from the dangers of extreme heat. We played games and provided snacks and drinks. Many were homeless who needed it the most. I have provided space for those self-help programs such as the Alcoholic Anonymous, the AA, the Narcotics Anonymous, the AA, the Domestic Sexual and Teen Dating Abuse Advocacy, among others, and have invested time advocating for children and adults with disabilities through special education rights and other services. I have committed myself to provide employment opportunities for many people by giving them a pathway towards stability and independence by employing 40 women, 50% farm worker women. We must remember that turning around years of Medicaid, Medicare, and legislation changes did not happen overnight. Progress and adjustment through these rural health initiatives and changing demographics take time, patience, dedication, and support. My record has proven with a history of providing services, families, creating opportunities, and ensuring vital programs remain available in Blythe. I am committed to the well-being of our community, and I have proven it since 1979. Bringing up the complaint over and over and over by Ms. Hudson that was rejected by the FPPC in November of 2023 is like beating a dead horse. Instead, channel that energy in creating solutions of what we have presently at hand and come together in unity and support the people of the hospital clinic program. Now is the time for us as a community to stand together. Let us do our job and focus on moving forward together with unity, faith, and patience so we can continue the work of keeping the hospital and the clinic's doors open for the people that we serve. Thank you very much. Okay, next item, approval of the agenda. Is there a motion to approve the agenda? Do you have a second?
Madam President, may I be recognized?
Yes.
At this moment, I'd like to request that we table minutes for July 10th, July 16th, and July 30th to allow staff time to fully review and prepare them and provide a final draft. Just to reiterate, it would be July 10th, July 16th, and July 30th.
I'd like to make an added comment here regarding Dr. Solobi. I am responding to your letter that was received by the board on August 8th, 2025 regarding the Premier Healthcare Partners Agreement. I understand that although there was a confidentiality provision in the agreement, Dr. Carrillo agreed to publish the agreement. Therefore, a copy of the agreement has been provided to you and posted on the district's website. According to your letter, you indicated that it is agreement. You indicated with the public.
You're not on the agenda.
According to your letter, it indicated the presence
This is all
that
May I
you
be
would like to.
recognized?
Yes,
Yes, I believe that you are completing your board comment, is
Yes.
that correct?
yes.
Thank you for attending.
According to the letter, you indicated that if the agreement is an exclusive agreement that you would like to present it to the MEC prior to board discussion. Please let me know as soon as possible when you will be presenting this agreement to the MEC so that we can move forward accordingly. Okay. Now we are, okay, now, I'm sorry, now we can go back to item 4. The approval of agenda, Dr. Brooks made a motion, Rosie had seconded. Joanna, can you call for the question?
May I restate, Madam President?
Yes.
We are approving the agenda while tabling minutes for July 10th, July 16th, and July 30th. Is that correct? Vice President Roa?
Aye.
Director Sargent is absent. Director Brooks?
Aye.
Director Hudson? President Garnica?
Aye. Okay, there is a presentation on ongoing transparency practices by Mrs. Anaya, Joanna Gonzalez, and Nina Wade.
Madam President, may I have permission to present from where I'm standing? I would like to go ahead and address and be able to face the board as well as the public.
Yes.
Thank you. Good evening, everyone. This evening, we have prepared a presentation that outlines the ongoing transparency practices. And I do apologize for the lack of eye contact. I am going to be reading just so I can stay on track. So, Jason, can you please? Thank you.
There we go.
You make a little bit, that's the biggest we can make it, that's fine.
I actually tried, I could do this.
Thank you.
There you are.
Thank you. Can our representatives and Ms. Hudson see this as well?
Yes.
Thank you. So we can move on to slide 2. Since assuming the role of clerk for the board in October of 2024, I have dedicated my efforts to understanding the Brown Act, its application to the board of directors, and my responsibility in ensuring compliance. As you can see here, agendas must be posted 72 hours before regular board meetings, 24 hours before special meetings, and a reasonable time, less than 24 hours before emergency meetings. We move on to the next slide, please. Since November 2024, the district staff has been including staff reports with the agenda packet. Although this does add additional time required to prepare the packet, we believe it is a necessary step as it provides context for the matter considered. We try to include history of the matter, a summary of the issue, and the action staff is recommending. Also, we include the documents that are to be considered if they are prepared at the time of posting. If the documents are circulated to the board members after posting, but before the meeting, the documents will be sent to all individuals who have requested copies of the agenda and made available to the district's website at the same time. Documents are also available for review at the district. For documents distributed at the meeting, those documents will be also available to the public at the meeting. If a third party passes documents out at the meeting, those documents will be posted to the website and available to the district for review after the meeting. Move on to the next slide. Thank you. So for this slide, we have some safe harbor language. The Brown Act does provide safe harbor language for the various types of permissible closed sessions. Substantial compliance with the safe harbor language is recommended to protect legislative bodies and elected officials from legal challenges. If a matter is not listed in Brown Act as an appropriate subject for a closed session, the matter must be discussed in public even if the subject is sensitive, embarrassing, or controversial. In November 2024, we compiled a list of what Brown Act calls safe harbor closed session descriptions for items that may be discussed in closed session. In addition to the Brown Act, there are also permissible closed session topics included in the California Healthcare District Law and the Civil Code. This is how anticipated litigation, existing litigation, and potential litigation should be agendized for closed session according to the Brown Act. And these are the examples. Next slide, please. If there will be real property negotiations, we are required to identify the property, identify the negotiating parties, and describe the terms under negotiation. And in front of you, you'll see examples. Next slide, please. If a person submits a claim against the district but has not yet filed a claim in court, it is agendized as a liability claim. If there is a threat to the public service or facilities, this is how it should be agendized. For employee matters that may be discussed by the board, these are the reasons the board may discuss these matters in closed session: appointment, performance evaluation, or discipline dismissal. The title of the employee The title of the employee and not their name may be disclosed. And again, these are examples. These are the proper closed session descriptions for medical staff credentialing and peer review and medical audit and quality assurance reports. And again, more examples. Lastly, we go to slide 10. For trade secrets, we include the name of the party with whom the district is entering into an agreement. As you can see, this is another example. That concludes my presentation. Thank you so much for your attention. I will go ahead and pass the time over to Lena Wade.
Thank you. So if you'll go on to the next slide, and again. So this is today's agenda. And as you'll see, Joanna's worked very hard to keep it similar to the way it existed before November. You can go on to the next slide. And the next. And so she includes what's to be considered by the board a description as required by the Brown Act. But also included in the packet, you will always find the staff report. And as she says, it gives a history, little summary of what's before you and the recommended action. In the next slide. And then the closed session items will be agendized as she has set forth in those safe harbor descriptions. And then I want to show you how they were done before. So next slide. So this is on your portal. This is from January 24, 2024. So there are no staff reports. Some of these contracts that are mentioned are not included. And then if you'll go, let's look at closed sessions. I believe it's, keep going, right there. So you'll see under closed session, it says radiology. Now there's not a Brown Act provision that allows for radiology to be discussed. Then you'll see it says personnel matters. It doesn't say the title, whether it's appointment, discipline, or evaluation. So there's not enough information there for the public to see, to know what you're doing, and also to let you all know what is before you. So go on to the next one. This is January 31st. Again, most of these agreements were not included. Go to the closed session. And then you'll see it says personnel matters. Again, we don't know what that means. Then it says report involving trade secret. Okay, so that's similar to the Premier Health, right? But here it says discussion will concern a service. So we don't know what that means. We don't know who that's about. So now Joanna includes the name of the party that would be the subject of that matter. The next agenda is February 14. Let's go to closed session. You'll see here again, personnel matters, we don't know what that means, and report involving trade secret. Discussion will concern a service. We don't know what that means, the public doesn't know what that means, we don't know if it's properly in closed session. The next one is February 28th. Go to closed session, please, right there. Personnel matters again. It says legal review of budgetary issues and proposal. The budget is not permitted to be in closed session. So what Joanna and Michael Rose have done is they've looked at all of these agendas and tried to pull that information regarding the budget and made that publicly available, because that was not, it's not permitted under the Brown Act or the Healthcare District Law or the Civil Code. Also, you'll see it says again, report involving trade secret discussion concerning a service, the public nor the board knows what that means. The next one is April 3rd for closed session. It says attorney comments about agreements for legal, IT, and project management services. That is not an appropriate Brown Act description. We don't know what agreements these are. We don't know why they are in closed session. It's very limited as to what the attorney can discuss with you, it's regarding litigation or what have you. That's how that's set up. But there isn't one like this. You don't know who's involved. The next is March 14. Go down to closed session. Personnel matters, business matters related to an IT service. Don't know what that means and don't know if it's properly in closed session. Star Medical Associates IPA agreement. Do not know why that's in closed session. There's no reason given. Rose Business Solutions Accounting Controller. Now he came on as a controller, I believe, at that time. So it should have been, personnel matter involved, and then put his role, and whether it's appointment or what have you. If they were considering the contract, that could never be in closed session because it involves salary, money. That would be properly in open session, but we don't know. Okay, the next one. This is April 9th of last year. Closed session, business matters related to an IT service. There's not a closed session item for that. The next is April 24, business matters related to an IT service. Don't know if that was proper, don't know what the IT service was and how that could be in closed session. Legal report, that doesn't say anything to the public or to you, don't know what that is. The next one is June 26, closed session. Here it says legal report, don't know why that's what that is. Finance-related matters, again, cannot speak about finance-related matters as it's presented here. You need to have a closed session description that's appropriate. Radiology services, don't know why that is listed here. The next one is July 24, legal report. Contracts outsourcing review, don't know why that's in closed session. Finance-related matters, again, you need to pull those out, and Joanna and Michael have done that. The next is July 10, legal report, don't know what that is. Finance-related matters, again, those have been pulled out. Radiology services, do not know why that's in closed session. And then we have October 3rd, legal report, personnel matters, again, don't know what that is. Finance-related matters, revenue cycle with GEBS, don't know why that's in closed session. That would be an open session matter unless there was some trade secret or something, but that, you would have to say that. And the last one is May 22nd, I believe, or maybe we already did that one. It's out of order.
Yeah, it might have been earlier.
Yeah, so this one says outsourcing review. I'm not sure what that is and why that would be closed session. Business matters related to an IT service, finance-related matters, financial consultant agreement, that would be open. So anyway, your staff has worked very hard to improve on the agenda and to make sure that there's more information available to your public and to you, particularly by including those staff reports, and we hope you find those informative. So thank you.
Thank you very much, Nina, for that presentation, and Joanna, for that also. It's that's enlightening, because last year when we were having this meeting, not one peep squeak out of all that stuff that was going on. Now that we're going according to what the Brown Act is, and we have an attorney that's her forte, carrying us over this. Now all of a sudden there's all kinds of people complaining. But last year, not a fly came in here. Only us were here, and our group here. So I'm really grateful that you are able to do that, Nina. It's we're very appreciative of that for keeping us abreast of this information. So moving on, are there any questions from the board regarding what was presented? Dr. Brooks? Ms. Hudson? Anybody else? So do we have any public comment?
Regarding the board comment?
On the presentation that was presented?
Thank you, Joanna. You put up some slide. Is there anywhere in Brown Act that states that the board can discuss any item that's not on the agenda? Can they do that?
It's your public comment, Dr. Salomi.
Correct, but do you know? You don't know.
We can talk after if you'd like.
Okay. Well, I'll tell you, if you're learning with Atlanta for 27 years, you cannot make any talk or any comment if it's not the agenda. And the problem I have is you're wasting this community's money, you're taking the hospital down and you're putting the money in an attorney's pocket to the tune of $40,000, $50,000 a month when you get bullshit advice and you don't even get it. Dr. Brooks made a motion to approve the agenda, Rosie seconded it. There was a discussion. You were ready to vote. You had long passed the board comment. The board comment was the item before that. The board comment was item number 3, and now you're on item number 4. And Carmela, you read a letter that I was going to say it anyways during the ABC because we have it for you. You wrote a letter today at 4:30 and sent it to me. So it was after the agenda posted. It wasn't before the agenda. But you violated the Brown Act. And rather than say, Dr. Salomi is my friend, maybe I shouldn't talk about this. Maybe I should talk about it some other time. You insisted on violating Brown Act and doing it. And then the board attorney lied to you. She said, oh, Carmela, this is your your board comment, correct? And you said, yes, it is. Well, you both lied. There was no board comment at that time. The board comment was closed. You did not let Ms. Anaya speak after she made her comment. She wanted to talk, you didn't let her. But you followed the board attorney's mistake. That's incompetent attorney who in a public meeting, she can be reported to the Bar Association and say, you lied. You know that this was not a board comment. This was clearly agenda. Somebody made a motion, Dr. Brooks, somebody seconded it. The only thing you can talk is agenda. You can't talk about anything else. So you violated the Brown Act. Why is it important? The important is so you don't run the board like it's your own business, your own 501c. You know, Rosie mentioned that, oh, I wrote the check to Escuela and I didn't send it to Rosie, to Carmela. But the money went to you. You bought the van. You enjoy the money. I mean, this is why Brown Act is important. This is not Brown Act so that you have a problem. You make comment, well, why everybody is complaining about Brown Act? Because you didn't violate Brown Act 2 years ago. And if you violated Brown Act 2 years ago, sitting on the board and you didn't say anything, then you have another problem.
Can I take any more public comment?
May I make one comment? I would like to publicly thank our IT department because they are the ones that created our PVH YouTube channel. And I wanted to give them the credit for the amazing work that they have done.
Okay, we will now have item 6 reports. an update on operations and finances, of the district.
You have the statement.
So, good evening and thank you, good evening and thank you for all for joining us. As a brief update this evening, I want everyone to know that we are actively pursuing outside funding and taking aggressive steps to collect all outstanding accounts receivable. We still await a response to our formal request for emergency and financial assistance from the state while we explore other outside funding opportunities. One of the new opportunities is funding through a program earmarked in the One Big Beautiful Bill Act through the newly created Rural Health Transformation Program. The funding is intended to provide immediate relief to rural hospitals while enabling facilities to establish the necessary tools for long-term success. That's exactly what we need, so we are pursuing it. Meanwhile, we continue with the intensive work necessary to reduce expenses and keep them as low as possible. We are making progress in all areas, but we have more hard work ahead to be in the position to offer the full scope of essential care that this hospital and our community clinic provide. I appreciate your presence, input, and continued support as we are doing everything we can to turn things around. Is there any questions from the board? Ms. Hudson, is there any questions that you have? Any public comment?
My name is Dee Coates, I live in Blythe. The only question I have about this financial thing is, how much are you guys losing a month right now? Are you still staying above water? Are you below water? Are you treading water? Are you still losing to around 200,000 a month?
900,000.
Are you losing $1 million a month? I mean, I don't know. You haven't told us that. And it's nice to have this transparency, but it would be nice to have the numbers list so we could see what you're talking about. Because at this point, we're guessing where you stand financially. And this is the biggest problem we have with all of you, is you don't give us answers. You don't give us paper so we can read this stuff, so we can see these numbers. It's easy for Michael to throw numbers out. He's the CFO. We can throw all the numbers he wants. But if I don't see it on paper, I don't believe it. And you shouldn't either. As a board and as a director of the hospital, Ms. CEO over here, she should demand a financial report every month for every meeting. You shouldn't just meet on saying, oh, we've got this, we've got that, we might have this, we might not have that. That's what is so discouraging about all of this is, you don't seem to take it as serious as you should. And if you want the public to be on your side and fight for you instead of against you, you'll start giving us financial statements. And you'll show us where the money comes in and where it goes out.
Yes, on the financial side, thank you, Dee, for making that comment, and I will follow that to say that I got to a major disagreement with you guys 2 years ago when you wanted to close the OB department. I didn't want the OB department to be closed, but you guys said, in order to save the hospital, we have to close the OB to save money. I said, okay. When any other way, they said, no, I trust Ms. Anaya, she had her analysis, and they said, we have to close the OB. So you guys closed the OB. Have you had anywhere, any study, Dr. Brooks, have you seen any number that shows closing the OB, how much money saved the hospital? Have you seen one? No. You're a board member. Sandy, have you seen one, Ms. Anaya, Ms. Sandy Hudson? Have you seen any study that shows how much money the hospital saved by closing the OB? Okay. Well, if you don't know whether or not closing the OB would save you money or lose money, how did you vote? How did you guys agree in that closed session? You know, we go through all this bullshit of putting these minutes up here from 2024. How much money do you think this attorney charged to go through all that minutes? She spent thousands of dollars. It's your money, clapping guys. You can clap all you want for me or against me, for Carmela or against Carmela. It's the attorney who makes the money. She made thousands of dollars. I promise you it's not less than $10,000. Okay? To go through all that minutes. Why? Why they didn't come 2 months ago? Only because she knows. She knows she violated the Brown Act by putting premier contract, the contract that has been done before in open session, she put it in closed session, and I tell you why soon. It was to hide the numbers. They didn't want this public to know. How many of you make $4,800 every 24 hours? How many of you? Raise your hand. How many of you make $7,800 every day? How many of you? Raise your hand. But that's in the contract. You don't want the public to know how you're spending the money. That's like Dr. Brooks said it to me multiple times, like a drunken sailor. So she makes all that money. She makes all that money to put all those minutes up there to act like this. She's the one who leads you by the leash to the wrong, by the nose, put you in wrong road and said, yeah, it was my comment during board comment. Well, it's recorded. Everybody knows you passed the board comment. Why would you follow her lead and say, yeah, it's board comment? No, it's not. You were a motion, a second, you're waiting for the vote. For agenda, and you go, this is all making money for the attorney, and then you think you're doing good job on fiscal finances? You know, you can laugh all you want, Carmela, but this is the OB that closed, we suffer. It's gonna be the hospital that closes, we suffer. You have plenty of money, you go elsewhere.
Okay. Any more public comment?
Maybe you should return the money yourself in the hospital.
Okay, that's it. Okay, well, now close public comment. Are there any comments from the board? Comments from the board? Ms. Hudson, any comment? Okay, moving on along to item C, medical executive committee report. Dr. Shinobi.
You missed item B. The attorney should tell you, Miss Lena, could you hold her hand and tell her the item B?
Any questions?
CEO.
Oh, CEO report. Yeah.
Just a CEO, nothing. Nothing, just a CEO.
It's all right. So, let me see if this is on. Okay, as for licensing and accreditation, we had a anonymous complaint made to the CDHP. They came out on a visit. We're not expecting any adverse findings from that, but the 2567 has not been finalized. A lot of allegations that were not true, and they looked at staffing sheets and every other thing and all the documentation we had. That's just somebody, I don't know what the purpose was, I would like to think it's constructive. We're waiting for our D&D survey. We're updating policies and procedures, there are new standards from NIHO, which is our accrediting body is D&B, NIHO standards. We're having the health fair and screening September 6th. We have a lot of collaborative partners coming. We sent the LAFCO report, I think that's come up a couple of times. Michael and I had a Zoom meeting with, I believe his name is Gary Thompson. They will send the report probably mid-September. So that report ended up to be about 400 pages. And all of the issues that have been addressed previously, the 60-day plan, the strategic plan, what we've done over the years has gone in that report, everything that they asked for. Current activities, you know that we had a cyber attack, but also we changed the electronic health system. We're going in and trying to refine all the external reports that have to go to HCI, other places that actually affected the delay of cost reports and some of the financial issues that have come up before. So we're trying to get that rectified for the future. I talked about the cyber attack. We had one in 2019. Department of Health called. They wanted additional information on that. We sent it. That one has been closed out.
We're still working with IHP for incentive dollars. Last year, we probably achieved over, it was around $2 million of non-operating income that came from incentive dollars. And I'd like to point out that when you have operating incomes coming in, you have to have patients in bed, you have to have surgeries. It's not only the COVID, we brought up all of the decline in revenue for various reasons. The managed care arena where you have a lot of write-offs. I'm sorry that people don't understand what contractual write-offs are. For Medicaid, it's gonna get worse. You have in Congress all of the issues that are coming up with the Medicaid cuts, Medicare cuts possibly, disproportionate share, everything that has kept this hospital going for a long time. I think it's miraculous that it's here still. In January of '24, when we had an interim CFO, he alerted everybody that we were going into the 8.5 million that we budgeted for. The only person in this group that started a financial committee was Carmela. It went through different board presidents who did not react. I recognize Mrs. Coate wants to blame me, but take a look at your board and who was here before, okay? I'm tired of the personal attacks. If you want to, we've brought forward financial agreements. We have cut staff, some of which were supposed to be people that we salvaged over the years, or they were on a favorite list. I can tell you that there are board members, a board member that came in with a hit list. Okay, a hit list for employees because they didn't walk down the hall the way that they were supposed to walk down the hall, okay? As if I am the one that finalized furloughs, etc., and we did it with the future of the hospital in mind. We salvaged people that knew med-surg. We salvaged people that could also do infection control. We moved people from med-surg to ED to keep the services open. We addressed the clinic and put people in that knew what they were doing and could come back to a job on med-surg when we opened. That's how we made the decisions. I am the one that went to the Med-Exec committee and recommended Melody Bowman because she works med-surg, she helps us out in the clinic. And when it comes to the clinic, that crew that's working in there now picked up 6 months of work that hadn't been done by the crew that was there previously. So if anybody wants to attack somebody for the furloughs, attack me, because I made the decision that if we open med-surg again and we go with critical access, that I have the people to be able to pull and staff it. So they're working emergency room, they're working med-surg, they're working infection control, they're helping collect revenue. IT is helping us get the information in place so we can send these reports out that affected the delays in the cost report. As it came to OB, we were losing at that time $600,000 a year, and the doctor that was our main OB person was having personal problems and wasn't even working in the hospital. Okay, we had another person, and that went on for a long time. There was a lot of money being paid. We decided, and if you look at the literature, there are a lot of rural hospitals that closed OB. You cannot survive on 6 deliveries a month. Okay? So if we have been transparent, we brought it forward, we tried to do our best. And if I listened to every rumor about kickbacks out there and whatever, I wouldn't be able to come to work every day. But we have clean consciences, we've done our best. I walked into this kind of mess in 2013, and guess what? Some of the players were the same. So we have done a good job. We're taking the nurses from the college. They're brand new, we're working with them, we're trying to get them education. We stopped our Flex Ed program so we could get them ED courses. He's safe in that area, and I'm looking forward to opening the swing beds and opening the critical access, continuing that part of it. Why? When I came in and I was interviewed, everybody was talking about the clinic.
that had been talked about way back to 207 that never got opened. They were talking about critical access, why the reimbursement is better for hospitals. Okay, and you can, and we have to go forward, and that's the way we're going forward. The clinic, we were trying to get out of the medical office building, which is about $22,000 a month. Everybody supported it. Yes, it was in the middle of COVID again. It got delayed for whatever reasons, but you know what? Our employees go there. There's a lot of people that go see Sylvia because they've known her for 22 years and they trust her. Okay, and that's a vital part. We would like to get it open 24 hours a day, at least 7 days a week. Why? So you can go there and not go to Intercare. We just got the IHP contract. We're trying to get the Blue Shield contract. The revenue was not allocated properly. That's why they're going back and doing the budget. Everybody wanted that clinic so we could move out of the medical office building, and that's 5 years ago. So if anybody has any questions about the operations other than mindless allegations that are being made, call me up. I will have coffee with you. I will have tea with you. I will sit down, answer your questions. People from the community have come in to ask me questions, have gotten the answers. We'll be transparent, but stop attacking when it's needless to attack.
Okay, any questions from the board regarding Mr. Lawyer's report? Any questions? Rosie, any questions regarding the, Ms. Hudson, do you have any questions regarding, the report, Ms. Anaya? Yeah.
I don't believe the clinic's using $600,000 a year, Ms. Hudson. We said at the last meeting, some of the revenue hadn't been allocated appropriately, and that's what they're doing. Plus, we didn't have the IHP contract, which we just got in April, and we're working on the Blue Shield contract, and we talked to Michael and some of the business people that are redoing that. I don't believe we're losing $800,000, okay? But let's wait to see until the numbers come in. Right, and we had some of the wrong people in place because somebody hired a manager that wasn't qualified, who wasn't doing the job. Let us go back and look at it, okay? Yeah, I know you don't like some of the people, but they're doing a good job. Yeah, it's being utilized properly. I'm not taking it personally, but, you know, the sidebars come in and they come in underground and we hear them and we know who's saying them. So I'm just saying my piece down for once.
Okay.
Yeah, well, you ran it for a year, Miss Hudson. And as far as the attorney goes, let me say this, we paid $500,000 last year for an attorney group that was not maintenance. I've gone through 3 different attorney groups. I appreciate what she's teaching us. She's been impartial, okay, and I'm sorry that people are taking it the wrong way, but we're all learning. And every time one of you comes up here, we try to accommodate a realistic, objective approach to what you're saying. Staff reports, we've learned that, yes, they're helpful, but we've learned when somebody like Leslie comes up and says, hey, this is hard to understand, we go back and we try to make it better because we know we talk in medicalese. And sometimes we have to get down and say, okay, we have to look at it a different way. But we've gone through 3 attorney groups, and I gotta tell you that I'm learning a lot from this group. They've been supportive, and they're playing to a board of 5, not a board of 1.
Okay. Now we will open public comment.
Hi, Elizabeth Bailey. Miss Anaya, I'm gonna address you personally.
That's fine, Elizabeth.
You forget that you're a guest in this town, even though you've been here 12 years. Do you realize I worked for you for 2 years before I even met you? Do you realize that I resigned on good terms? Do you realize there's been 3 employees that quit without notice on numerous occasions and you hired them back? You're getting kind of lackadaisical because you're opening your mouth and speaking loudly when community members hear you and it gets repeated back. So we're very aware of what you're doing. Also, part of your job is to communicate with the chief of staff, Dr. Salobi, anytime there's any physician complaints. To my knowledge, there is a very concerning complaint going on right now that is not being communicated with the chief of staff, and the public have a right to know about this physician. This is where we lose trust with the hospital. Palo Verde Hospital is a laughing joke to other hospitals. Do you understand that? If we go to Palm Springs, they laugh. The nurses are embarrassed. Your contract is month to month, and according to our bylaws, you should be evaluated every single month on what you're doing. And Carmela, you keep speaking about this progress we're making. I just got notification that we have 20 days of cash on hand. You want to talk about the clinic? Please explain to me how the clinic is making money when it was closed 8/1, 8/8, 8/15, and now we're up to 8/20. You saw 21, 15, 19, 17, 17, 14, 11, 17, 16, 9, and 13 patients in August. And we do not collect funds for all that. We don't even know because you don't provide us the reports. Another concerning factor I have is Dr. Brooks, Dr. Salobi, Dr. Lucero, Dr. Rodriguez, all of our local physicians, and Dr. Arco. They have earned the title of doctor. They went to school, they passed their boards, they participated in the community, they have earned their title. It's concerning to me that the public keeps referring to Sylvia Herrera as Dr. Herrera, and she is not correcting it. She is a nurse practitioner, certified by the Board of Nursing. And the community is falsely informed, and many people that I have spoken to thought she's a doctor. That is very concerning.
Any more public comment?
Yes, I want to say something. Yes. Let me explain to you something, Elizabeth. My education was my education from Mexico was accepted in the United States as a doctor. This is a reason because they tell me doctor here. And if they don't want to tell me doctor, it's fine with me. I went to medicine school in Mexico. I couldn't bring my transcripts to the United States because it was, for me, it was, I went to a scholarship and in Mexico, and then my school didn't accept to bring this transcript to the United States. But they accept my education. I can show you the papers. I can show you the day. I took all the papers to Miami, and they gave me the medical doctor education accepted in the United States. It's fine with me. If you want to say that I'm nothing, I am humble. I don't care. Okay? But I want to tell you that I'm making money for the clinic. You should know. How much? You should know that whatever I do, all the labs, all the CTs, all the MRIs, all the outpatient treatments that is coming under my name is revenue for the hospital, not only the visits. Okay, in another hospitals, they take that as a revenue nurse practitioner so-and-so is making this amount of money. Okay, if the center knows how much money I make, you should know.
Thank you, Doctor.
Any more public comment?
Since you got to that point, I need to correction. It's a violation of Medical Practice Act to either not correct people who call you a doctor, to say, I'm not a doctor, I'm a nurse practitioner. Nurse practitioner could be as good or better than doctor. But you need to correct them and say, I'm not a doctor, I'm a nurse practitioner. If you don't do that, that's violation of Medical Practice Act. Medical Board of California can arrest you for that. Number one. Number two is, the discussion got to a point of referral. Well, let me finish that. First of all, God bless Dr. Pagliano. He was, I recommended to bring Sylvia to the clinic. And he said, Dr. Solveig, she needs years of practice in my office before she can even see a patient. I cannot let her go see a patient on her own. That's Dr. Pagliano. God bless him. But on top of that, you are talking about referral and supporting the hospital. That's baloney. Talk is cheap. Show me the numbers. We have Dr. Solveig, Dr. Arco, and Dr. Spector that could see the patient in my clinic, my office to do patients. You guys go talk to Elba Salvi. She is my office manager. Most of you know them. Sylvia Herrera sent us maybe 2 patients in a year. She did not support this hospital. Only because she was trying to get more money from me for her office. She had a confrontational situation with me. She had a lawsuit against me. She didn't send it. But even before that, she didn't send much. We got more patients by Dr. Rahimi in 6 months of the first 6 months of this year than we got by Sylvia in the last 5 years. Okay? So if she wanted to support the hospital, the first thing she should have done is support the hospital. She did not. She did not support. She put her personal agenda ahead of time. One thing I can say, I wish I could say it again about Carmela or Rosie, but one thing I can say, Miss Anaya, she doesn't put her personal agenda ahead. So maybe you guys should learn. If you want a hospital that's prosperous, you need to have a clinic. That was why we supported the clinic. That's why we said build the clinic. The clinic, everybody knows in this town. And I supported that from 27 years ago when I say primary care doctor make decision what to do with their patient in the ER. Why? Because the primary care doctor are the lifeline of this hospital. And we've lost many primary care doctors, SAG, Inner Care, and Sylvia. She doesn't send patients to hospital. So you want to help the hospital? You should have helped the hospital in the last 2-3 years, which you didn't. The numbers are there. I waived my right. Anybody from the hospital, anybody from Sylvia's friend can go to my office and ask how many patients she referred. Did you read that? You okay, Rosie? Did you read that? You can now listen. Okay. All right. How many patients did she refer to? Dr. Spector, Dr. Arco, or myself? It's a number. You can't fool the numbers. You can just talk shit.
Okay. Any more public comment regarding the CEO report?
Hi, okay, so I'm a patient of Dr. Sylvia now, and when Dr. Shalobi was practicing, I needed some surgery done, and she asked me if I wanted to go to Dr. Shalobi. I said no, because he has horrible bedside manner, and so yes, me speaking for myself, yes, she does. And even for my daughter, she gave her the option, do you want to go to Shalobi? And just not too long ago, she referred me to Dr. Arco, which, unfortunately because of the situation, I couldn't have my surgery done. But, I just wanted to speak on that. Thank you.
Okay, any more public comment?
Madam, can I get your full name?
Elizabeth Rojas.
Thank you.
Okay, no more public comment, close public comment. Any comments from the board? Dr. Brooks?
No.
Ms. Rao? No. Ms. Hudson? Okay, seeing none. Next item on the agenda, Medical Executive Community Report.
Thank you. First item on the agenda, we had the CEO report. We had the MEC meeting yesterday, in person participant with myself, Dr. Bowen, and remote was Dr. Arco. Dr. Brooks was a guest of honor, as he's been on the MEC and medical staff before, and we also like him to understand the issues before he comes to the board so we can discuss it with you in closed sessions. We received the management report, as stated by Ms. Anaya. And we, under the committee report, we had a quality performance improvement committee summary for the emergency room. I'm sorry, I participated to that meeting, actually, the committee meeting, performance improvement committee. And I was there, of course, late, but that report was transmitted to the MEC. There was on the old business, just on the old business, I want to discuss this very briefly. Rosie, I have full confidence in your daughter. I have no quarrel with your daughter. I respect them, I trust them, I like them, I love them. That wasn't the issue. When I talked to you, if you go back and look at and listen to the recorded speech, I said, are you afraid of making the right decision for this hospital and this board because you think your daughters are going to lose their job? That's what I said. I did not say you can go back and look at it. I will play it for you next time. I did not say that they don't deserve it. I am the one who advocated and got the rest of the medical staff to approve your daughter to be the infectious disease control nurse based on Ms. Hudson and Ms. Anaya's recommendation. I had no quarrel with that. I think she was a perfect person for that. I don't think she is corrupt. I don't think your daughters are corrupt at all. I don't think you're corrupt, Rosie. I just think you're misguided, naive, and you follow the lead of somebody like this attorney and take the hospital down with it. That's all. All right? So that's the 2 cents, and I'm sorry I took that time under MEC. New business, we discussed the emergency department manual. We reviewed it, and it's not on your agenda to approve it approve it right now. However, because DNB may come and inspect us at any time, we passed that. We have it ready just in case, and hopefully the board can have another meeting soon to approve it, or DNB should be okay with that. Now, under new business also, we had a long discussion, as Carmelo mentioned it. The issue came up in the last meeting. A simple resolution of that would have been saving us $10,000 from attorney's fee, but we wasted it. The issue came Premier ER contract. And that Premier ER contract was on the closed session, and it was under trade secret. I mentioned it friendly to remove it and put it on open session. You could have just moved it to open session and done with it, but you didn't. Instead, you fought me, you argued with me. Then a week later, I get a letter from Joanna that says, hello, Dr. Solway. We have obtained approval from a single corporate shareholder of Premier Health Group, Dr. Cardillo, to publicly disclose the agreement that was approved on July 30th during the closed session. Dr. Cardillo has no right to dictate to this community what he wants to be in open session or in closed session. He has no right. He's making $4,800 every 24 hours, or $70,800 every 20 hours. We don't know where it is because we have no room, but he has no right to tell us, just like the contract you give me. I have no right to tell you that this is confidential. You can't disclose it to the public unless I say it. Every member of this community should know how much I get paid right now. They should know how much Melody Bowman gets paid. They should know how much Sandy Anaya gets paid. They should know how much the attorney gets paid. Have you guys got that report? I mean, I've never seen the attorney report to say how much you spend money on attorneys. Not even 1 month. But that simple issue ended up in MEC because this was a significant issue. You violated medical staff bylaw. And I specifically asked Rosie and said, is this exclusive contract? And you can go back and look at the video. you shake your hand like no. But then the attorney jumped in and she wouldn't let you talk. She wouldn't even let you talk. She says, no, you don't have to, and you backed off. But that was an exclusive contract. And according to the bylaw, you should have taken it to the medical staff first. But why is it important? Why is it important is what the MEC has prepared, and we're ready, to bring it down to everybody's attention. First of all, I'm sorry, and then today, 20 minutes before, I get a letter from Carmela, email, that we have obtained approval from a single corporate shareholder Premier. I'm sorry, that was Joanne. She says, I'm responding to your letter received by the board. And then it says, Dr. Cardillo agreed to publish the agreement. And this letter came only an hour before the board meeting. Dr. Cardillo has no authority, responsibility, or power to decide whether or not that contract goes to the public or not. It's the board who makes that decision, not the attorney, the board. But you guys decided to go closed session and approve it. Now, what are the issues? I'm going to go over the issues that we discussed in MEC, and I will hand you the letter that came after at the results of that. On page 4 of that contract, it says, this is a Premier contract, it says appointment. Well, let me ask you, Carmela, who is the medical director of the Premier group? Do you know? Carmela, who's the Premier medical director?
This is your time, Dr. Schwartz.
Say it again?
This is your time.
Oh, I know, but do you know who the medical director is?
This is your time.
I know, I'm using my time,
No,
you don't know who the
answer.
Okay. See, this is why the public is upset. It's simple, if you know, you say it. You say, Dr. Cardillo is medical group, Dr. McAfee is, Dr. Brooks is, Dr. Sloan is, but you can't even answer a simple question. That who is the director of this group? Because the people who go to that ER, they want to know who the director is to go complain about the ER, but they don't know because you're not willing to say it. But I'll read it to you. I'll read you page 4. You should have known. Why you should have known? Because it's page 4, item 1.4, medical director A. Appointment. Within 10 days thereof, group shall nominate a physician for medical centers approval as medical director of emergency department. You haven't nominated anybody. So you already breached that contract. The 10 days is passed, you haven't nominated anybody. And you don't even know who it is, even if you have nominated. All right? This is section, page 5, section 1.4 B VII 7. Attend, this is the job of the ER doctor. Attend director, job of the ER director. Attend meeting of the medical center's medical staff. Has never happened. None of them have ever attended a single meeting. Then under qualification, on the page 5, on item 1.5, this is the direct violation of medical staff bylaw. Under 1.5 qualification, each group physician shall be a member in good standing in the active staff category of medical staff. Rosie, do you know what active staff is? Do you know what active staff member is?
Go ahead and tell me.
All right, Dr. Bush, do you know what active staff member is? What qualifies a doctor to be an active staff? You don't know. All right. Sandy, do you know what active staff is? I think not.
Bylaws thing.
All right. Well, the bylaw is very specific. Active staff should be a physician who live in this town and has office in this town. It may be waived only by the medical staff. That's very clear. Yes, it's in the bylaw. But in this contract, it puts all the ER doctor active staff when they are not. They're consulting. So that's why you should bring this to medical staff, so we can teach you, help you to say what is active staff, so you don't violate the bylaw. Now you're going to spend another $10,000 for attorney to go through all my issues and try to fix it. Now, item 1.11, medical staff membership and or clinical provision of the group physician at the medical center shall be deemed resigned concurrently with the expiration or termination of this agreement. So this contract basically says, somebody like Dr. Arco, if you cancel the contract with this group, Dr. Arco loses his contract. Why? or other doctors who work in there and want to work there, you cancel their contract, then you cancel their medical staff membership. What if Premier doesn't provide you doctors tomorrow, and you have no contract, they cancel their contract, and then what do? You close down the ER because you don't have a doctor. It was simple. You could have waived that, say only if in emergency we could keep those doctors. But you didn't. A simple way to save a hospital thousands of dollars so we don't have to go locum tenens, and we got free, but we didn't. Exclusivity. I ask again, is this exclusive contract? And the attorney didn't say yes. Rosie at least was no or unsure. Section 2.3, exclusivity. There is a section, exclusivity. Medical centers shall not contract with any other physician or entities for professional services to be provided by the group under this agreement. Why? If Dr. Cardillo tomorrow get to an accident and he is not able to handle the hospital ER, we can go hire another doctor to cover the ER? Why? Why can't we? These are the problems that you have with this contract, but you weren't willing to listen. Thousands of dollars now, Leno is going to charge you, trust me. And section 4.10, again, same thing. It says even if the group, now Dr. Cardillo, does not have a contract with that doctor that says your privileges will expire if the contract expires. Even though there's no such contract, that physician loses his privileges. Why? It's unnecessary to tie your hand as a board, as a hospital CEO, tie your hand to the hand of a group that makes $7,800 every 24 hours. Now, under page 17, 7.19, trade secret. Again, that's another lie that the attorney told you. It's under trade secret. No, the trade secret is right there in the contract. And the trade secret is not for you guys. Trade secret means you guys, just like what she babbled about all the other ones, after 2 years she's picking on the other ones. Trade secret is like if you want to buy the building next to the hospital, you don't want anybody to know because somebody go buy it, so you have to pay higher. That's trade secret. Trade secret is not for the guy that you pay him $7,800 every 24 hours. So he has access to your trade secret. But read this. It's baffling. It says, during the term of this agreement, group means Dr. Cardillo group, may have access and become acquainted with confidential information and trade secrets of the medical center. So you're letting him and his group find about your trade secret. Not that there is a trade secret that is beneficial to you. You're allowing a third party, somebody else, know about your trade secret. Why? It's just baffling. Now, I'll go to Exhibit D, stipend. Exhibit D is stipend. It says, I'll skip that part of it. It says that the hospital will pay fixed operational costs. The hospital will pay fixed operational costs. What are fixed operational costs? Physician hourly salaries, medical director fee. Dr. Brooks, do you know how much the medical director fee is for this GIGAR group? Do you know? You don't know. Rosie, do you know? I don't know. Nobody knows. But I know how much it was a year ago when I came across it. It took me over a year to find out as a chief of staff. I kept hearing that the medical director makes a lot of money. I said, we don't have a medical director. We never approved the physician for medical director. I asked Trina. Trina tried to get that information. It took her 6 months, and finally she said, I'm trying out, and she said, Dr. X is worth $7,800 every 24 hours. I said, look, if you have the money, put Dr. X on for every 24 hours, but you don't have the money. You need to be financially, fiscally responsible. But how much are they getting paid? Didn't know. It wasn't until Sandy Hudson got on the board, or got, whatever, she got involved, and I asked her, even that took 3 months. And Sandy can tell you who she got it from, but she finally got the numbers. We have a physician, Dr. McAfee, who got paid $10,000 a month to be the medical director of the group. $10,000 a month. On top of the $4,800 a day or $7,800, whatever else she got, on top of it. And I managed the ER scheduling for 10 years, never got paid a dime, never asked for a dime. Because it wasn't a big deal. Now, she did some other stuff, but she got paid $10,000 a month. And I said, okay, where is that we approved her as a medical director? It's not. Well, in the contract, it said she should be approved. It's not. So finally, Sandy talked to Dr. Cardillo. They realized that it's violation of the contract. They took that off. So we saved the hospital $10,000 a month. But I couldn't convince you guys to ask him to pay back all the other money that he got paid. Why? Because he got it paid against the contract. That wasn't by the contract. But I'm not stingy. We save the hospital money, that's okay. So that's the problem with this contract. You have no number in front of medical director fee. If Dr. Cardillo charges you $100,000 a month right now, you have no legal basis to say you don't pay. You don't. There's nowhere in this that limits you. Nowhere. That's the type of contract you guys approved in the last board meeting. Now, there is a medical malpractice fee and billing fee. Medical malpractice fee, we don't know how much it is. If malpractice fee goes up or down, you have to pay for it. That's something that I understand you may or may not have a choice. But if it was me, I would put a number to it. I would say no more than $10,000 a month, for example. But you don't. Billing fee, there is a percentage, I believe it's 5%. An administrative fee, 10%. On top of all this money that they make, they take 10% of your collection. So if you collect $200,000 a month, you pay $20,000 a month as administrative fee to making the schedule, putting the doctors on. Now, what I argued with you guys for a long time, and I believe this is why this was in closed session, because you were ashamed to say that you knew about this. I discussed it with you over a year ago. I said, you can't put a medical director fee. This should have been crossed out of that, but it's in there. I said also, you can't have a contract. How many of you can give a contract to your landscaper or plumber to say, you can come fix this for $4,800 or $7,800? Nobody would accept that. The plumber would charge you $7,800 if you give him between $4,800 to $7,800. But it's on the contract. But now it says, now who decides it's $4,800 or $7,800 or range in between? It says, as determined by the medical director. Who is the medical director? We don't have any, we don't know. Who is the medical director? The same person who writes the check for herself or himself. She or he decides who gets $7,800. Ridiculous. And Palo Verde District Board, did you guys ever, in the last 10 years, ever, one of you voted to give Dr. X $4,800, Dr. Y $7,800, Dr. Bruce? This never came to the board. You guys didn't even know that. It was never on the agenda in the last 10 years. This is in the contract, but you have no control over it. And CEO, remember, it doesn't say or, it says medical director and the board and the CEO for each individual physician. That means you three, the board, the CEO, and the medical director, should all three agree who gets paid $4,800 every 24 hours, who gets $5,000, who gets $6,000, who gets $7,800. None of this happened. So you've been violating this contract, and now you renew to violate it again. Okay? So what happened? We went through this contract, and we had an extensive discussion what to do. And Dr. Bush can talk to you in closed session about this. Well, before I forget, we also had the MEC. This was a peer review also. We reviewed a couple of physicians and radiology, and we have not made any decision. The MEC was MEC / peer review, even though it is not say that on the title. So, what is the final results? Okay. Just point, Carmela, you mentioned that Dr. Cardillo agreed to publish this agreement because there was a confidentiality provision in this agreement. You're wrong, Carmela, once again. Because you didn't read it. That email was drafted, I bet you $1 million. That was drafted by the attorney you just sent it, okay? You think the confidentiality is what prevented it. But on the agenda, on your own agenda, you approved, and you as a board chair, you run a meeting. Well, actually you didn't run the meeting. The attorney ran the meeting, and you approved that agenda. The contract for Premier is under trade secret. You said it was in the closed session because it's a trade secret. You remember that, Rosie? Okay. Now, the letter comes out, she says, Dr. Cardillo, although there was a confidentiality provision in the agreement, and Dr. Cardillo agreed to publish it. Again, Dr. Cardillo has no right to confidentiality, but I'll read you the confidentiality clause of that agreement. You'll be laughing. 7.6, Premier contract, confidentiality. It says, under this confidentiality, 7.6a, it says, Group, I don't read the first part, I read in the middle. Group shall not disclose the terms of this agreement to any person who is not party or signatory to this agreement unless disclosed thereof is required by the law. So this disclosure agreement and confidentiality was not to limit us to release it, to limit this board to release it, it was to limit Dr. Cardillo and his group to release it. But either way, it's ridiculous anyways. You should have removed it. There's nothing confidential. This is a hospital that is a district hospital. There should be no clause of confidentiality. I went to court with it, and that was it. It's very clear. This is district hospital. Even if you put 600 confidentiality clause, even if you put in there, if you told you have to pay $5 million, you won't pay a dime. Because you cannot restrain the public from knowing what is financial contracts that you approve. So this confidentiality contract prevents the Dr. Cardillo and group to talk about it, not you. But Carmela knew that the problem is that she violated the medical staff bylaw. This was an exclusive contract, so she followed the attorney's lead again, and she said it was a confidential contract. Now, we'll see how the letter comes next week to change it, if it's confidential or not. So based on that all said, the medical staff voted unanimously to write you a notice. This notice is, if you don't follow it, we'll go to court. In 10 days, we'll be in court. You pay your attorneys, and you pay our attorneys, both. According to medical staff bylaw, you pay up to $200,000 a year our attorneys. I don't want a single dollar to go to her, let alone go to our attorney. Resolve it before it gets to be a problem, okay? So the letter reads, pursuant to the Palo Verde Hospital medical staff bylaw, as last ratified by Palo Verde Healthcare District Board on January 25, 2003, any exclusive contract arrangement for physician and or professional services must be presented to the medical staff at least 6 months prior to any decision being made. Not to bring it now after you approve it. You take your approval away. You can pay whatever it is. But this is section 14.3 of medical staff bylaw. Read it. I said, at the July 30, 2025 board meeting, during public comment, I specifically asked whether an emergency department physician, professional service, and medical directorship agreement, Premier agreement, was an exclusive contract. Director Rosie Rao appeared to indicate no by shaking her head until the attorney intervened and directed her to be silent, to remain silent, which she complied with. I advised the board that if this contract was in fact exclusive, it must be considered in open session, not in closed session, and referred to the medical staff for review under section 14.3. Despite the warning, the board proceeded to review and approve the Premier agreement in closed session. I filed an official complaint for violation of Brown Act right after the meeting. On August 15, the agreement was provided to me by email by Joanna. Upon review, it's clear that the Premier Agreement is indeed an exclusive contract as confirmed in Section 2.3. By approving the Premier contract in this manner, Palo Verde Healthcare District Court violated medical staff bylaw, which the board itself ratified. In addition, several provisions of the agreement directly conflicts with the bylaw, therefore requires revision before lawful implementation. I review most of it, not all of it. At its recent meeting yesterday, the Medical Ethics Committee reviewed the Premier Agreement and determined that the corrective action is required accordingly the MEC hereby requests that Palo Verde Healthcare District Board, number one, formally, not say I sent it to you through email, formally present it means you want the medical staff approve it, it has to go to Ms. Anaya. Ms. Anaya come to the MEC meeting, she presents it to us. Present the Premier Agreement by MEC within 10 days of receipt of this letter pursuant to Section 14.3 of the bylaw. Number two, allow the MEC to review the agreement, propose revision to ensure compliance with the bylaws, and thereafter return a final version to the board for approval. If the board fails to honor this 10 days notice and continues to disregard the bylaws, the MEC will seek judicial intervention to enforce compliance. As set forth in Section 14.1-3, the bylaws, the MEC is entitled to recover attorney fee in connection with enforcement action. That said, we wish to avoid needless expenditure of the hospital resources, particularly when the hospital is already under financial strain. Litigation would only enrich attorneys on both sides while diverting funds away from patient care. Our intention is not adversarial, but corrective, to ensure that the board action remains consistent with medical staff bylaw and thereby protect the integrity of the hospital governance. We urge the board to remedy this violation promptly and in good faith. Respectfully, signed by myself. Dr. Brooks was in that meeting, and he can tell you that I was holding the medical staff back. The medical staff wanted to go to court with no notice because you guys egregiously violate the medical staff bylaw. I mentioned it to you publicly. You have the attorney sitting here. The safest route would have been, okay, we'll take it to open session, or we'll do it next week, we'll do it tomorrow, give us a minute. No, we decided to violate medical staff bylaw. So as a result, I'm going to present this letter through the CEO to you. This is the only copy, Ms. Anna, please if you can make copy for. She'll make copy for all the board members, including Ms. Anaya and Ms. Sadi Hudson and Trina, to make sure that the board makes a decision what they want to do in 10 days. Thank you very much. If you have any questions, please ask. Otherwise, that concludes my report.
President Garnica, if I may be recognized?
Yes.
Just for the record, this is the same agreement that was approved January 31st, 2024, exactly the same. So stipends, everything that's in there, exactly the same, the only thing that changed are dates.
Okay.
Just for the record, I objection to that, Dr. Bush. Remember you asked me, you said, Dr. Sobe, have you read this agreement? And I said, no. That was 2 years ago about the ER. You said, Dr. Sobe, have you read this ER contract? I said, no. And I said, if you guys want to approve it without my approval, it's your choice, first of all. Second, this competent attorney is the one who came and criticized all the adults. Now she waves her hand because she wants to stop me because she knows she's in trouble. She is the one who said all the other attorneys were terrible. They didn't know what they were doing.
Is that your conclusion of the report?
No, I'm finished. And that's when she said that
Is there any open public comment?
Yes.
Is there any public
I'm
comment?
making public comment. Thank you.
Okay, start the time, please.
Thank you. She is the hospital attorney who came in public meeting and she says, all the other attorneys were incompetent because they made a mistake. Now she is coming around and she says, because they made that mistake and they approved this contract, then it's okay for me to approve it. Well, you can have it both ways, Lena. You can't have it both ways. If they were bad, then accept that they made a mistake. You're perfect, you're the best attorney in the world, then you should have not put it on the agenda, on the closed session. Now, I think there's a good solution. If you really want to put your money where your mouth is, don't charge the hospital. For all these mistakes, don't charge the hospital. You went through all of that presentation, which you spent at least 8 hours, and I will ask under Public Record Act, I will ask for your invoices to find out how much money you spent on that, and I will make you ashamed of charging a hospital that's broke to benefit you financially. I will find that out and I will tell you. You're spending all that money so you can lead the board by their nose to a ditch. And now you're saying, just because the previous attorney made a mistake, I made a mistake too. No, you're such a great attorney, you should have known. You are expert in this, you should have known. Exclusive contract should have gone to the medical staff. There was no trade secret, you lied about it. It shouldn't have gone to closed session. You drafted a letter, we will find out. You drafted a letter that says it was a confidentiality issue. It wasn't. You are on the record, you said it's a trade secret. Now you changed it to confidentiality. You know, it's easy. It's easy to sit there and make $300 an hour. It's the rest of us who will pay for it when the hospital closes.
Any more public comment on this presentation? Any board comment?
Yeah, I'd like to make a comment. Yeah.
Speak up to the.
Oh. Sorry. I didn't make a comment I heard in this session as well as the previous ones for the last couple of months, 3 months. And it reminds me of a saying attributed to a great admiral from a 3 centuries ago. And his statement was, America, may she always be right, but our country, right or wrong. I'd like you to substitute America and just maybe put it in our own hearts. The hospital. There's a lot of diverse opinions, and what we're gonna have to do, if it's gonna succeed, is aim for unity, for some way for that to happen. Instead of an eagerness to chew somebody's head off. God bless Ozzy Osbourne.
Okay, Rosie, any comment?
The comment that the lawyer made, when I was going through this contract last week, I noticed that it is a, well, anyway, it was built on the contract that we had before, and I thought, this is fine because it's the same contract. What's the problem? If Dr. Salobi was questioning the contract, he could have come in and spoken to us. We were talking about it in closed session. Am I right? He could have talked to us, right?
In closed session, if you had invited him
We had
into closed
invited
session.
him.
Rosie, I wasn't invited, I never saw it.
We can't hear you, Rosie.
I'm sorry. And I'm not accustomed to public speaking. I was saying, I noticed when I went through this contract month. I knew it was a renewal of the contract, that's the word I was looking for. Renewal of the contract we already had. I assumed that Dr. Saloli had seen the old contract. And so if it was all right last year, it should be all right this year if it's the same darn contract. So I'm questioning, and I don't want you to answer it, but I'm questioning why you found all of these deficiencies in a contract that you already saw last year.
I just told you I didn't see it. Did you hear me tell you I never saw it? And I also, Rosie, it was in closed session. That was the problem.
But you could have come,
If it
we
was,
would have
no, I
invited
couldn't.
you.
No, it would be violation of the confidentiality. I can't go to closed.
I have the floor right now.
Okay, I'm sorry.
We could, if there were any questions, we would have invited you in. We do it occasionally, we invite you in to explain things. We could have invited you in, listened to what you said, had fixed it, or whatever needed to be done. We could have done it then.
May I? Okay. Rosie, when you heard me.
No, there's no public comment.
Why did you ask me to go closed session right then? A month ago you did that last.
Okay, Ms. Hudson, do you have any board comment?
That's how you tarnish the people's image.
Go ahead.
Raise it loud.
I beg your pardon? Ms. Hudson, do you have any board comment regarding the report that Dr. Salobi just gave? Okay, thank you, I do not. Now, do we have any public comment on the MEC report?
I am sorry.
Oh, no, you're a perfectionist. You know how to run agendas. No. Oh, you mean you missed the credentialing interview and the credentialing and the practitioner 566 and practitioner 5067? Oh, no, but you're the perfectionist on running agendas.
Do you know what
Okay, go ahead and continue now. Go back to the agenda where you were at and finish.
You can laugh all you want. You're the one who's running the board. You're the one who should be saying, Dr. Salobi, item number 2B is not there.
Go ahead and finish.
Okay. What I wanted to come and say is this.
Finish your agenda, finish your.
No, I can't. You passed the agenda.
Okay.
Okay, now I want to ask you.
No, other comments now.
See how ridiculous you think this is your 501c you're running it. I wanted to just tell you, your CEO told me you missed the agenda. He told me. So I wanted to tell you, Carmela, you are you're so strong.
Oh, come on, that's ridiculous.
You left 2 physicians without credential for your personal agenda. You idiot.
And she doesn't know.
Okay,
Can I say something?
No.
this is, we are open public comment in regards to the presentation that Dr. Salobi did.
Johnny Rodriguez, 1140 North Kid. Some of the audience on Zoom cannot hear the sentence being muffled. I'm guessing it's because people are yelling, but they cannot hear the agenda or the comments being made. So if it can be made clearer for them, I'm sure they would appreciate it. Thank you.
Okay, any more public comment?
I am employee, my name is Sylvia Herrera, I'm employee for the hospital, I'm not part of the medical staff. And I'm tired, Dr. Sonobi bringing to my name and bad money every time that he talks about the medical stuff. I'm not doing anything against the hospital. I'm not telling the patient not to come, not to have surgeries with him. I'm not taking money from anybody. I was not expecting getting money from Dr. Sonobi. I just wanted him to pay his bills. And that's the only thing that I did. Every time I didn't correct anybody about that doctor because I don't supposed to talk when they are talking here. So I know that they are doing because they have respect for me, and I appreciate that.
Talk to the mic, please.
On the microphone if you want.
Oh, in the microphone. Yeah, they call me doctor because they have respect for me, not because they know that I'm a nurse practitioner. They know that. And I don't correct them because I couldn't correct them when they were here. But I don't want him to call me a stupid idiot like he does every time that I try to say something to him. And in the same way that he did to Carmela. And he told me a bunch of names because he doesn't like something. It's really annoying when we try to say something to him. So I try to stay calm and quiet and try to be nice, but it's impossible. I don't, he still have his old belongings in my office and my property. He's trying to take my property, I think. It's my personal opinion because he still have all his stuff. But he brought this one to the MEC report. He doesn't have nothing to see with the MEC report to say that I am this and I am that, and he should stop doing this. I'm not doing anything. I'm not doing anything wrong to anybody. Thank you so much.
Any more public comment?
Well, I have to admit, that was the show of voices tonight. Did he finish doing his report on the credentialing and stuff? Was that done? Or did it just get thrown up in a mess and kind of out of the way? Can I get an answer?
Yeah, it's on the agenda, so it's before them for closed session, it's laid out. So
Okay, he's already finished his then.
Well, he did as much as he wanted to do, but whatever's on the agenda, they can take action on, and it's agendized for closed session.
Okay.
So it's fine, it's complete.
Okay, that's what I need to know. Also, shame on you, Garnica, you shouldn't have been yelling back at him. You played right into his hand again. And I know it's hard, I know it's very hard, but you should have more class. And you should just say, okay, I have nothing else to say and leave it at that. Because it demeans you, and I think you're above all that, I really do.
Any more public comment? Seeing none, close public comment. Board comment? Close it. Ms. Hudson, board comment? Okay, next item on the agenda, item D. Requirements for selling, leasing, or transferring Palo Verde Hospital.
Yes, so included in the packet, and this had already gone to the board and wanted to make it available to the public. So as you're considering options for moving forward, one may be considering proposals to purchase, lease, or perhaps transfer the hospital. So just put down the steps here. It's a very transparent process that's set forth in the healthcare district law. And so there'll be meetings, public meetings to discuss any proposals as they are vetted and ready for you to consider. So I don't think I need to spend much time, but it's a roadmap for how that process is to work.
May I add a comment to that? Okay, on, just happen to have the minutes here, on June 7th, we had that special finance committee, it was on a Saturday, update on operations and finances of the district. At that time, we read a comment, and here it is, Joanna had put it in the minutes, part of my report or part of my discussion. So I want to make this very clear. Senator Padilla's office connected the hospital with a local medical group that not only built a strong and solid reputation, that has thrived in in Imperial County. This group is familiar with the Blythe community, understands the unique challenges of serving rural hospitals. They have expressed interest in partnering with Palo Verde Hospital to improve health access locally. Early discussions began, and the group is willing to share both general practitioners and specialists, including rheumatologists, urologists, and pulmonologists. Based on Senator Padilla's referral, I asked Lena to put together what it would take. Even though I've been here in the past, you had it, Brim was a management company, AHA was something different, and then it went back to a district hospital. So I asked for guidance and anticipation that anything come further, and it was documented at that minute. And it was read out loud in public, a lot of the public was there. So I just wanted to remind people how this came about. Okay.
Is there any questions from the board regarding? Okay, Ms. Hudson.
There's an interested party which we brought up both at the city and whatever, but there's been a couple of visits at this point. And if anything went through, it went from attorney to attorney. Hospital, they have, according to them, Ms. Hudson, they have specialists, a lot of programs that they can offer. There were a couple of looky-loo discussions where they came and looked at the hospital, but that's about it so far. They were talking about possibly sending a proposal, but I don't know where that's at right now.
Dr. Brooks, any board comment regarding this? Ms. Strauss? No. I have none either. We are now open for public comment regarding this Lena's report.
Glenna Peoples, 17920 Green Street. I know that Parker Hospital was also interested in maybe joining with us. The big barrier is the $12 million in debt. Is that also a barrier for anybody else? Is there a way that the state could maybe make that disappear so that we're viable? It's pretty apparent from our meetings that we're not a functioning group together. And the big beautiful bill is going to also impact us financially in a way that's going to hurt. Being bigger is probably going to, and spreading out our resources and sharing them with partnering with Parker and another group is probably the way forward. But is that also a barrier for this group, or do we know, or even that part of the discussion?
He and I had discussions, I think, that the CEO from Parker at that time, there was no interest in the hospital per se, okay, because they're Arizona and he did come to a couple board meetings and there was nothing discussed about taking over whatever it is. So, but you're absolutely right, we had this discussion with I had it with Dr. Saloni and Dr. Brooks. It may take a big group, you're gonna have not just physicians, but somebody with corporate backing and money, because you can anticipate more Medicare cuts, more cuts in disproportionate share. Medicaid, we don't know what the effect of the Trump's proposal for the hospital bill, the bill that's coming forward. And so all the rural hospitals, we received a report, there's 200 and something in California, every rural hospital's in trouble. And so either, that's why I asked for this, because you can have somebody come in and manage that wants to put an infusion of money in to begin with. You could, a corporation to take it over, rural, university, Loma Linda, somebody like that has money. The whole idea that we would want is keeping the community here to as, not for tertiary care, but at least for basic care. Because that's a big issue here is access. So in looking at med surg and the other places, you want to be able to admit the patients that you can take care of, and that's in the, everybody's mind as well. So that's one of the reasons why I didn't know, but I know that Brim was a management company. I saw that in old grand jury reports. I know them from other areas in California, so I knew they managed. And I think at one time you had somebody called AHA or something like that. I don't know how far back that went. I don't know if they were district or if they was a private company, I don't know. But in anticipation that somebody would come through, then I asked for guidance on this as well, for guidance with the board and the community, because now we know the roadmap.
I can also add this, so for the loan, the distressed hospital loan, that can only be assigned to a nonprofit or another public agency. If it's a private company wanting to purchase, they would, that loan would have to be paid off first. Now, with respect to having it waived, SHAFA will only consider waiver of annually. So whatever's due that year, there's a deadline by which the district would have to apply, and then they could get a waiver, on that annual amount each year. So that is something that we just had a discussion with SHAFA about 3 weeks ago, and learned that. So we weren't sure how that was gonna affect the proposed sale, so now we know. If it's gonna be a private organization, it has to be paid off first, or part of the proposal to pay it off first.
And then our offer is still out there. I still have the dirty dozen RNs that are willing to do whatever we need to do to help support you guys. We want to keep this hospital open. It also bothers me, this is a whole different topic, but there's a few people that still work at the hospital that I really trust. And it's why I take my family there. It bothers me when we start mentioning an employee by name. It also makes people that aren't in the medical profession not want to use our services. And I see we have two problems. We bicker amongst ourselves, and then we don't have customers. And that's we're making our own self-fulfilling prophecy once again. We do need to offer way more services. Closing OB when we are 100 miles from anybody, it makes our young women have to go 200 miles to their prenatal appointments. These are things that we might not open OB, but we need to open telemedicine services so they can at least see an OB while they're here. There's a lot of things we need to do. This isn't just going to bring apart our community if we lose these services. We have girls dying. We have people that go out 100 miles each direction for their chemo treatments. Maybe we need to look at the medical bylaws. Maybe physicians that do not live in our community need to have privileges at our hospital. But thank you for your time.
Any more public comment?
I just had a question. I know that you guys put it on the minutes. You already got my name correct. Okay, I was just wondering, are we able to ask as the public who it is that, or the group is that we're looking at possibly, or who's coming in and wanting to check out our hospital? Is that like a question that can be answered this meeting?
I don't know the exact name, and I'm telling the truth. Okay, it's a group, they have a professional name, and I don't know that professional name. But it's like a looky-loo going through the house right now, that's looking at open house. I don't know whether to take it seriously or not take it seriously.
And but you'll let the.
Yeah,
when we
absolutely.
have
As they
something
come
that's like
forward, it
credentialed
comes-
and then you
it
got a
comes here.
cater call, you're gonna let us.
Yeah, it comes here.
Okay, I appreciate it, thank you.
Yeah, you're welcome.
Any more public comment?
I've got two things, independent. The first is I'm going to object again. I believe that this agenda is flawed and that this is an illegal meeting. Ms. Wade, you can say no, and I would appreciate if you do actually. And then the second item is, I don't recall in the last 8 months worth of agendas seeing anywhere where you've authorized anybody to negotiate, your attorneys or Ms. Anaya with another party, but I'm hearing that there's a possible negotiation with the second party. How is that legal? Because I know it violates the California Health and Safety Code for healthcare districts.
There's no
That's what I have.
negotiation, so.
Okay, if you say so.
Yeah, I do say so, and also it's my opinion that the agenda is appropriate.
Okay.
Any more public comment?
Well, I just have one question. You guys are $12 million in debt, am I correct? Maybe a little over? And if you get the 8.5 million forgiven, and the state of California gives you 4 million, won't that just about clear you out and give you a way where you can go forward? And my other question is, what about the 32 million upgrade on the hospital, on the one end of the hospital where it has to get up to earthquake, I don't know what you would call it, preparedness or something? Is it 32 million? Michael, you would know, you're the CFO.
You don't have the firm estimate.
You don't have a firm one? Okay, well, let me ask you, if you get that, if you can get that 12 million, and you could maybe dig yourself down a little bit, and then, I think, it was the CEO that said that half of the hospital could be turned into like a rehab. You could have that, but not patient care, full-time patient care in there. Is that correct?
I think it's an OSHPOD issue, we're looking into that as part of the seismic, what it could be used for.
And that would be with the swing beds and everything?
Well, the swing beds and the critical access are all on the same unit, you don't have to have a special unit, as we said, you convert them over to swing. So all of the area around med-surg has been, validated for licensure for swing bed under critical access.
Okay, then my next question is, have you guys sought 8.5 forgiveness, and have you pretty much said it with 4 million coming from the state? That would put you at the 12 million, and you could pay your way out of what was left over. You know, you could maybe balance it out and pay it out that way, and maintain this hospital.
We're trying with all of the different things that have gone on.
But I hate to see our hospital go into the hands of somebody that is not local.
Ms. Jones, I believe your question's gonna be addressed during the continuing resolution.
Okay.
Excuse me, so,
All right.
yeah.
I'll come back.
Any more public comment? Close public comment. Okay. So next item, item E. Continuing the resolution fiscal year 25-26 budget. Michael and Vanessa?
All right, good evening. The budget draft has been prepared for fiscal year 2025-2026 in accordance with governmental budgeting standards. And these drafts have been presented in the board and finance committee meetings. Adjustments to the budget per board direction and staff input have been incorporated into the budget to reduce operating expenses. There is still a deficit for the fiscal years that need to be closed to balance the budget before final adoption, as was discussed at length at the July Finance Committee meeting. District staff continue to work with state representatives on additional funding for the district and the IGT options. Both state and IGT funding would close the budget gap. And this did come up previously in public comment regarding the $4 million, as we are still working with the state on this and the IGT funding. So as these two items present a very material impact to the fiscal year 2026 budget, it is recommended, while these are still in negotiation, it is recommended that the continuing resolution be adopted based on the 60-day plan that made significant cuts to operations to help bring stability to the district's finances. This continuing resolution, with this continuing resolution, staff will continue to explore and implement additional opportunities to enhance operations, to guide the district towards solvency. And regarding this, a significant step was made today with the business office and the relocation to the hospital. So we are making as many steps as we can to save cash wherever we can, to make the hard decisions, to make sure that we can bring this budget into balance. However, this is the most material impact for the budget is going to come from state funding and IGT negotiations.
So if I just may add to that, so before you is a resolution that would allow you to keep operating without having first approved your next fiscal year budget, because the budget can't be balanced at this time. So your staff is seeking 60 additional days for that, for continuing efforts and working with the state and federal representatives. And utilizing the 60-day plan that you have already adopted as a guide moving forward. So they're seeking approval of that resolution that's included in the packet.
Okay, so are there any questions from the board regarding Michael's presentation?
No, I read it.
Ms. Hudson, any questions? I have none. Okay. Open public comment regarding this presentation?
Is that where I come back?
Yes.
Okay, back to my original question. If you get the 12 million taken care of, and I know it's over 12 million, and you might have maybe close to another million you're gonna have to pay off somehow, some way. But if you can do that, utilize that part of the hospital again with the swing beds that we talked about for the last year, is there a chance that this hospital could become viable in, say, the next 2 years?
Right now, we are exploring the options before us. There are a couple of moving pieces with each of these. So right now, we are working with a very reduced staff to try and explore every option to bring additional services to the district.
Okay. Now, my next question is, if we can keep this hospital, and I'm gonna ask you ladies this, I know I have bitched and complained, I hate that word, but I've done it, and I've done it to her, I've done it to you, but it's out of frustration because we haven't had answers. I've gotten more answers tonight than I have in the last 8 months, and I appreciate this, I really do. My question to you ladies, are you willing to resign and put a new board in and see what they can do? That's my question.
There you go, she just answered you.
Well, I've got 3 more names that need to come, I need to hear answers from also.
I haven't made that decision yet.
Because you've accused us of not wanting to do things. And shame on me, I'm as guilty as the next person. I thought we voted in people that we could trust and handle this hospital. I had life get in my way like everybody else does. I've lost my husband, my dad, and my mother, and my sister, and life has been shitty for the last 10 years. I can guarantee you. But I still love this town, I love this hospital. This hospital has saved my life more than once. And I want to keep it here because I'm 78 years old and I know it's going to have to save it again. And I just want something in this community that we can put our faith in, we can put our trust in, and we can all back as a group. I'm tired of this bickering as much as anybody else is. But when you sit there and you look at us like we're stupid idiots for asking these questions, and then you get offended because we ask them, you get offended because we ask for a recall, you leave us no recourse. Work with us, not against us. That's what we're trying to do. And if it costs you resigning, then resign and put somebody in that will give you a break. You've done it for 10 years. Aren't you tired of it yet? Aren't you tired of being abused verbally by the public? I would be. I mean, honestly, let's be honest about this whole thing right now. If everybody wants goodness and grace, let's put a board in there that's willing to work for the next 2 years and see what they can do. That's all I'm asking you tonight. Thank you.
Any more public comment?
I do. Facebook Live. I just wanted to say, what she just said. My name is Amnesty, and I just wanted to say, I'm glad that he is here. I am glad she is here. Because, yes, all that bickering does need to stop, all the slandering memes does need to stop. It affects not just them, but our families as well. We're not gonna get nothing solved by bickering, okay? So it does need to stop. We're adults, you know? Let's come to the meetings and let's stop with the bickering and shouting. We're not getting nothing done here. I see this and I'm like, wow, really? Come on, you guys can do better than that. I appreciate all of them, all of them, all of us. Big props to all of them, because with all that happening on Facebook and all that, that is beyond ridiculous. You know, we're here to save the hospital, not close it. We're lucky we have emergency doors open right now. Come on, you guys, do better. Do better. That's right. Any more public comment? Okay, seeing no public comment, we will now close public comment. So we are on the resolution. Okay, so we need a motion to approve the continuing resolution of the fiscal year 25-26 budget. A second.
I'll second.
Okay, Ms. Ramos seconds it. Call for the question.
Vice President Roel.
Aye.
Director Stern is absent. Director Brooks.
Aye.
Director Hudson. President Garnica.
Aye. Okay, next item on the agenda, item 7. Review and approval of the minutes. Joanna, do you have any comments?
Yes, I do. Thank you. So the outstanding minutes previously tabled at the July 30th, 2025 meeting are presented for review. However, I recommend the following edits. Minutes for June 25th, 2025, the closed session report reads inaccurate for item 9B2. The correct report should read the following practitioner was approved by Directors Hudson, Garnica, and Brooks, with Director Roel recusing herself. I take full accountability for that error. That error was on my end solely. In addition, the practitioner's name is misspelled and should read Melody Bowman, not Bowman. Minutes for June 25, 2025 and May 28, 2025 reflect a misspelling in the community member's name, Leslie Jessup Watkins. The name should reflect an O, not a Q. At this time, I respectfully request that the minutes for the July 10th, 16th, and July 30th meeting be tabled, like mentioned earlier, to allow additional time for preparation and presentation for the final draft. Unless there's any additional revisions that anyone has brought forward that need to be made. Thank you.
Is there any public comment?
Yes, Ms. Wade, that was a defective agenda. Glad you caught it now.
Okay, thank you.
Is there any more public comment? Okay, close public comment. Is there a motion to approve the minutes?
So what the motion would be to approve the minutes listed in items A1 through 8, subject to the edits stated by the clerk.
Okay, so do I have a motion? Okay. Okay.
Vice President Roa?
Aye.
Director Sargent is absent. Director Brooks?
Aye.
Director Hudson? President Garnica?
Aye. Next item on the agenda, Palo Verde Hospital Community Clinic Medical Director Agreement, Ms. Anaya.
Okay, so the medical director is required a certification for rural health clinic. We are accredited by the compliance team to meet the federal standards. And Dr. Arco has been the medical director for the past couple of years. We'd like to continue with him as the director. I extrapolated some of the information that he's responsible for. We work with him. He does NP chart review, oversights the quality assurance program, and helps with, licensing, equipment, et cetera, consultative. So it's a required position.
Okay, is there any questions from the board regarding what Ms. Anaya just read?
Yes. He was on the phone yesterday. I believe it was yesterday that we had a telephone conversation and there were other issues that he addressed as well. If not, Monday.
Any more public comment? On the board? No, okay. Open public comment regarding this agreement. Okay, no public comment, close public comment. Is there a motion to approve the community clinic medical director, Ms. Hudson moved? Do we have a second?
Yeah.
Is there a second?
I'll second.
Call for the question?
Vice President Roa?
Aye.
Director Sargent is absent. Director Brooks?
I'm gonna abstain.
Director Hudson? President Garnica?
Aye.
So the motion has failed.
So what happens if we don't have somebody there?
Then we're not meeting the requirements of the standard. We even talked to him about coming into the clinic 2 days a week, so, unless somebody, other than that, I would have to bring it back and find another medical director. You have to have a medical director.
Mm-hmm. Oh, okay. Oh, we gotta look for somebody else.
Okay.
Oh, yeah. Looks.
Move on to the next one.
Okay.
So the next one is brought back because I think Leslie brought up an issue with, the contract, but it's a third-party payer contract alignment. And it's if either a PPO or HMO member comes in, we can call this group for durable medical equipment, so they, go home with the equipment they need, there's no cost to the facility. And it is registered, the Advantage Plan includes PPO and HMO enrollees if they're enrolled in the plan, and we don't know. She brought up, there was no HMO, but you don't know about PPO, so if they have PPO, we can get them durable medical equipment through, alignment. So it's like any other third party payer contract.
Okay. Is there any board question? Are there any questions from the board? Okay. Open public comment. No public comment, close public comment. So, is there a motion to approve the Alignment Health Plan Agreement? Could I have a second?
I'll second.
Okay, there was a second. Call for the question?
Vice President Rowell. Director Stewart is absent. Director Brooks.
Aye.
Director Hudson. President Garnica.
Aye. Next item, Siemens Medical Solutions USA proposal, Mr. Mayor.
It's a service contract for the ultrasound machine that was purchased last year. It's gone through the legal review, but if you don't have it, you're gonna pay a lot of money outside of the agreement for preventive maintenance, et cetera.
Any questions regarding this agreement?
Yeah, I read it, I have one question. This Floridian attachment, it was, from 2024, it's Krista, it was an attachment from Krista. And I was wondering if it's still, everything on here is still the same.
This is the new ultrasound
Yeah.
machine that was purchased.
Right.
Yeah.
So, I was just,
Yeah.
because this is dated in 2024.
I don't, yeah, I'm talking about the general contract.
Oh, okay.
Okay.
Mhm.
Okay.
The service agreement, you correct me.
Okay, open public comment? No public comment, close public comment. Okay. Is there a motion to approve the Medical Solutions Agreement? Okay, Sheila, Rosie.
I'll second.
Rosie, did you second it, Ms. Hudson?
Yes, I did.
Okay. It was moved by Ms. Hudson, second by Ms. Rowell.
Call for the question.
Vice President Rowell.
Aye.
Director Stewart is absent. Director Brooks.
Aye.
Director Hudson. Director Hudson. Thank you. President Garnica.
Aye. Okay, next item on the agenda is closed session. Is there any public comment regarding the closed session items? Agenda items, which is item number 1, medical staff credentialing and peer review pursuant to Health and Safety Code, section 32-155, and Government Code, section 54-957. Practitioner 5066, initial appointment. Practitioner 5067, initial appointment. Item 2, hospital quality assurance report pursuant to Health and Safety Code, section 32-155. And item 3, conference with legal counsel regarding potential initiation of litigation pursuant to Government Code, section 5495, 6.9D41, and one potential case. Okay.
I'm not sure if anyone wanted to make a public comment, because it seems like you may have read that
Did I,
So you may want to ask for public comment.
Yeah. Is there any public comment? Any public comment?
I just have a quick question. Is that on the CEO administrative report? Is that what you're voting on tonight, all that information?
No, it's on the staff report,
Oh,
the written staff report on the overview of the assurance plan, is that what you're talking about?
Yeah.
Okay, any more public comment on that item? Okay, close public comment. We will now go to closed session. Okay, you can start. Okay, we are now reporting out of closed session. Ms.
Wait.
Ms. Wade, can you please, report out?
Yes. So with respect to item 1, medical staff credentialing and peer review, that matter was tabled to await a recommendation from Dr. Shalobi. Item 2, hospital quality assurance report, there's no reportable action. Item 3, conference with legal counsel regarding potential initiation of litigation, there is no reportable action. Thank you.
The meeting is now adjourned.